Well, lovely to have Julie Edge back with us in the studio. Every time we talk to you, you bring up quite an interesting, refreshing look at what's going on, because you, I suppose, say nothing to lose, but you have been your own person all the time, I guess. Would that be a fair thing to say? You haven't been easily dissuaded from speaking out to the public?
No, and certainly I stick to my principled approach, and at the moment, particularly with Manx Care, I'm just really concerned at the way it's going. We cannot continue as an island to keep putting funds into a system that's broken, and I'm not actually seeing anything that's coming forward as a tangible solution. It's cuts to patients, and we need to make sure that we've got the right health service in place for the Isle of Man. In the 70s and 80s, Paul, I worked in the system. We had 60,000 residents. We had 750 visitors to the island annually. We had the TT. We had an excellent health service, and here we are today. All we're hearing is there's not enough money, and I know I've got colleagues speaking out saying it's underfunded. Prove it's underfunded to me, because I certainly know that they've had increase after increase. So Jonathan Michael's recommendations were recommendations. We didn't have to do them all. And certainly I haven't seen all of them being implemented. So it's really concerning. And
But way back when that 3 million answer was brought in, Manx Care was going to be this thing between DHSC and the Minister and Tynwald, and this thing was going to bring all these people in, and they were having all these ideas to save money, wasn't it? I mean, to bring things under control and to look after that budget. It's yet to do that.
Yet to do that, and certainly, obviously, the late Andrew Foster, when he was the chair back in 2021, he actually, in the press, it's available there. I'm happy to share it with you. Stated that we've been given extra money. If we and one of the problems and the issues for the people on the island was overspends, and he's actually commented and said, if there's an overspend, it would be a failure on the Manx Care board. And here we are back, in 2024, and there's been a failure every year if we look back at what was stated at that point in time. So there's something seriously wrong. It really needs sorting out.
Well, a flurry of emails came out from them. All these didn't address anything like an interview with me or anything. But the fact is, they're going to withdraw more things. Like Ramsay's going to shut for the weekends, and it seemed more cost cutting than actual solutions.
Yeah.
This is just a sticking plaster.
It does, and they talk about over 190 contingent part of the contingency plan. I've got a question in next week with regards to the contingency plan. Let's have it published. Let Manx people see what's really on this list. Council of Ministers have clearly agreed it for these cuts to take place. Certainly wouldn't have been my first area for looking at cuts when it affects patients. I thought actually yesterday some of the announcements were absolutely appalling. It was World Mental Health Day, and here we are announcing cuts to Cooth and Quell, which is a system that's in place for the mental health of young people. It's a 24-hour online service that they can utilise. That's one of the cuts. Yeah. And I thought, that proves to me that the culture's not changed.
They're suspending it for a while, I think, wasn't it, what they were saying?
Yeah.
I mean, they've got a lot of people who work in that department just in press releases, I'm guessing, because there's a flurry of them coming out.
Well, our health service should not be a marketing department, and certainly that's what we're seeing at the present time.
Okay. But, the fact is, with everything that's going on and this pause to some surgery that's going on, the minister said they can do that. I don't get involved with that. Now, does that ring alarm bells or not? That shouldn't someone at the top still have some control or at least some input, rather than just leaving it to this board?
I think it's been really helpful since the Minister stated that, and he also stated that it was the Treasury Minister had enacted the contingency plan, which is what I'm asking to see if it's been enacted. So it was clear that the Minister was aware of it.
And he says they can do it.
And he's saying they can do it, but normally with anything like this, and certainly we've seen it in the past, haven't we, where the Council of Ministers haven't particularly liked a decision and they do a U-turn. So, I'm not saying that we should do a U-turn. We shouldn't do any U-turns. If the decision's been made for financial reasons, it should be, continue. However, tough decisions do have to be made, but they should not affect patients, in my opinion, I think there's many areas for solutions, and it seems to be focused at Nobles Hospital. I haven't heard many conversations around the rest of our health services.
And of course the survey was done just with doctors at Nobles, and the minister went on to X to say you should do that survey to all the GPs on the island. And I'm thinking to myself, well, that's an interesting thought, but I mean the fact is you've got to deal with what's already there, and that was the best you can come up with. That sounds strange to me.
And certainly, I think that immediate reaction on Twitter and going onto social media is proven to me, again, the culture's not changing. I would be sitting down with doctors, I would be saying to them, we appreciate the comments, and I know that the intention is for that to happen with the Isle of Man Medical Society and the BMA. However, to go straight away on social media and say do it to the GPs, that's a possibility. But some of these GPs are employed by Manx Care. So,
well, I mean, with your strong background for whistleblowing and your passion for that, there was me talking to the Isle of Man BMA guy, and I mean, you probably got that same feeling that he was doing it probably against the best nature of what Manx Care would like him to do, which is quite difficult because, again, this is the sort of thing they don't want people to talk out about these things.
They don't, and certainly from watching the interviews, and I think one of the comments that was made, I need to be careful what I say here, I think that clearly indicated to me that it's difficult to speak out. I think
it's the culture, though, isn't it?
It's the culture. It's definitely the culture.
Manx Care, I assume, it's Manx Care, don't want him necessarily to do what he did with me, that interview. And I know he did one a week earlier on the radio, and I think that also he got a bit of, feedback, shall we say, being polite.
Yeah, and he certainly said that. And, I do hope that, I think he finished part of the interview saying,
if I'm not here next
week, I certainly hope that we've got our professionals. It was true professional that was speaking to you, giving the doctors' views, and these should be listened to. They're the professionals in the field. They're the clinicians in our hospital, and anyway, they need to be listened to.
Manx Care are going to do a survey with everyone.
Well, yes, but do you not think the right thing to do, and I did put that out on Twitter, on X, and I said, well, do the same survey, ask the BMA to survey the 3,000 people, rather than a different survey going out. Let's have one survey, and then our Chief Minister can look at that survey outcome and decide for himself.
And also, you've got the whole thing, should Manx Care do their own surveys, because you just don't know. People might be worried about putting down answers if they think they if it's not completely and utterly anonymous, you've got to be totally watertight on that, haven't you?
You have, and I think from what the BMA can offer, it's set up. Let's just open it up to the 3,000 employees.
Well, where are we going, though? I mean, there's so much negativity, and the health service is such an important part of the Isle of Man. People coming to live here want to know, and obviously people who live here already, that there's going to be something there when they need it. It's
the most important part of living on an island. You need to know you can get good healthcare. We need to have good, excellent education system, connectivity often on the island, and our infrastructure needs to be appropriate. And a lot of people are saying, is Manx Care underfunded? They don't pay for everything that a UK trust would pay for. They've got centralised services that they utilise. They use OHR centralised services. They use the GTS system of government. They're not a fully devolved statutory board, which from the outset of Manx Care was one of my concerns, because we cannot actually say what the true cost is for Manx Care. It's more than what we're hearing today, and they're already overspending.
And you're one of the people in Timber who have to agree that every year the overspend has to be sorted out. I mean, it has to. There's no way around it. They cannot have a black hole that isn't filled, because otherwise things will completely break down, right?
Well, that's right. But to do an elective surgery, and then to say that it's to help with bed space in the winter months. We've lost so many bed spaces, and I know that's possible from prior to Manx Care, but what have they done to try and fix that? We've also got elderly people, in wards waiting for long periods of time to go to nursing care, and there's lots that could be fixed to make it more efficient and effective.
We know what the problems are. What is the fix in your view? Is Manx Care fit for purpose? Let's try that one.
I certainly think not now, and certainly if you go back to when it was implemented, and what Sir Jonathan, the late Andrew Foster stated, if they overspend, they're failing. They've failed every year.
No one's resigning. I don't hear anybody disappearing, new blood coming in, which is the usual thing in a business that's not doing what it should do. You bring in some people who maybe have a better
understanding and of our island. And I think what's actually happened is, and Sir Jonathan Michael, it was recommendations, but it was a UK trust model. It clearly doesn't work for the Isle of Man. I think we've probably got people employed that are from the UK trust model. It's failing the people of the Isle of Man. We need to change it, and that decision can only come from the Chief Minister and the Council of Ministers. And I'm hoping next week we will hear some answers to it. I know Chris Thomas said that he thought that the Health Minister would be gone within 7 days. Here we are 3 weeks later, and we're not seeing any changes. And I do
His reactions on online media are very odd, in my view. I've been on the receiving end of it. Although he removed everything, he said, well, still, there's potential that I've got an issue with him about what he's about me. I mean, that's not necessarily the right way of handling things.
That's not a person that wants to sort the problems out, and I think we've got to get that solutions for all of our people. The doctors clearly are saying we want to be part of it, but that just needs to be changed. So Cooper's got to go. So I do believe that it would have happened to many. It's happened quicker to other people with far less issues.
He's not going. I don't get any impression he's going to go voluntarily, unless I'm wrong. I mean,
but this is where we need our Chief Minister to step up and do what's best and right for the people of the Isle of Man.
But now we all know we live in a low tax environment, but we want all the Rolls Royces that goes with a UK sort of system, and then they've got their own problems as it is. Is that possible? I mean, we talk about Jersey and Guernsey having different models where you pay to see a doctor, like in Jersey, and there's no private healthcare. People even want to do it over here properly. Officially again since 2019 or something. What are the solutions?
I'm actually seeing an awful lot of private practices setting up. I heard an advert on the radio today for them.
You can do your own private thing.
So there are people setting up to do private. I think a lot of people are already accessing that. And I think one of the issues, and I think the BMA rep Prakash stated that some of the consultants are allowed to do private, and others aren't.
Again, he's very careful. If you're face fitted, almost.
Yes, I listened to that, and I sort of thought to myself, that's when our hospital worked really, really well. We were like a training hospital for doctors. They wanted to be here, but our consultants also had access to doing private services. One of the areas which I think is another solution is the Manx pay and terms and conditions for Nobles Hospital. So they moved away from the national health scales, and that probably does cause an issue.
They're outstanding, aren't they, on their pay thing?
They are.
They're way behind now, aren't they?
And it all needs looking at, and it does need somebody going in there forensically looking at this.
It's got to end at some point. I mean, they've got to agree at some point. It just goes on forever. Between 5% and 22%, whatever it was, it's got to be sorted.
And of course, the CEO, I think she's saying that it used to be like around about 40-45% spend at Nobles Hospital. It's gone over 50. Well, the management should have controlled that. They should have made sure that couldn't happen.
Of course, the numbers of Manx Care has gone up over the years. I know they've got less half-time or part-times or whatever, but again, there's still people piling into this organisation.
There is, and they're still advertising for directors. Look at the situation with the medical director. There was two people in the post. There was Mr. Sri Andoli, and
this is one
that was in Liverpool, and where we was paying for two people, and this is where I think that a handle hasn't been kept on the.
Okay, so the CEO of Manx Care has to go.
I certainly think that there's more than the minister that needs to be answerable here for the people of the Isle of Man.
It'd be nice if they come on here and have a little chat with me. I would love to hear from someone from Manx Care.
And I've listened to the CEO's interviews on Manx Radio, and I accept there's many challenges, but to one of the areas, and particularly because it was an area that I picked up on, was the elective surgery, and that was through my constituents, to then go on interview and say, but we can bring it back. Well, you're not saving anything if you're bringing it back. It was a small amount of money in our hospital, £225,000. I could probably pick up their accounts now and say, well, if you don't appoint, I know there's some highly paid jobs out there ready to be appointed. Don't appoint them. I'm hearing of people possibly being on consultancy day rates in figures of over £700 and things like this.
You just advertised a biosphere job for so many months, but people are kicking back about that one as well because.
And I appreciate the CEO yesterday saying, we're going to look at give better oversight to all of the appointments. That should have been happening, Paul, from day one in 2021.
Okay, well, this week Tuesday, everything's back.
Yep.
School's over, school holidays are over, back to work.
Yeah,
I'm joking. You know what I mean?
No, there's a lot on the order paper, and there's a lot of questions, but there's some good motions.
How's your little opposition party doing this? You, Chris Thomas, and who else?
Claire Christian, Tim Glover.
Oh, right.
Yes. So we've actually all put down motions with regards to the conference topics. So obviously that's connectivity, immigration, and our economic plan, and also the size and scope of government that needs to be tackled.
So this is going to mostly to the Chief Minister?
Well, it's general debate so everybody has the opportunity to contribute into that, and then there's the separate motion that Chris Thomas has down about Manx Care, and a new direction, and that's really to try and work. The consultants have said that actually this isn't completely broken. They're prepared to work ways around it, but I'm not sure now with the toxic culture that's been described that it can be with the current and existing makeup of people.
I referred to watching the post office debate in the UK, the inquiry. It feels almost like that sort of thing that this organisation is so unwieldy now and so looking into itself and protecting itself.
It's got to that point.
It's not taking anything from other people.
It's not.
I don't know. I'd love to know more.
It's a tough job, and I do hope the CEO will come and speak to you because, there's an awful lot of good work that's been described and been done. However, we cannot keep bailing out Manx Care. As I say, go back to what the late Andrew Foster said. It's failing if it's overspending, and it's continued to overspend, and it's gone into the multi-millions now.
I mean, this stops obviously with Alf Cannon. Does he have to go? In that sense, in New Jersey they have enough people to have a backbencher. They overturned their chief minister and got rid of them.
Yeah.
Here it's almost impossible because most people are in coma and it's just not happening. But do you think Alf Cannon can turn anything around in his tenure now because it's not gone too well so far?
The CEO described turning Manx Care around as a tanker. They haven't turned the wheel of the tanker yet, in my opinion. However, the Chief Minister, I feel, should have been taking action much sooner and making sure we protect our health services, we make sure we've got the right people and we're listening to our consultants. They're the professionals in the field. Let's listen to them and make sure we've got good teams of people working in the best interests of the people of the Isle of Man.
But, I'm turning to a record now about this, that the civil service is running the whole thing, but it seems now, we've had proof of that when I've been attacked. Again, is that a problem? Because Alf Cannon is not, it appears he doesn't have enough control on what's going on always.
I think it's down to leadership and how you lead, and clearly he's had a new team around himself. It's been very difficult. Do I think he could still step up to it with the right team around him? Probably.
But the same civil servants are in place that, the gatekeepers are still there.
You can address civil servants, and I'm fortunate to have the knowledge of how that can be achieved, but not every politician has.
Are you hopeful finally then that things can get better?
No, I'm not seeing any improvements.
You see, that just sends out shockwaves.
And I do hope that the Chief Minister, in Tynwald on Tuesday, does do a good autumn statement. The Treasury Minister needs to be doing a good statement as well. They are holding Manx Care to account, according to the interviews, because that's the only information we've got at the present time. They are perhaps holding them to account, but they should have been a bit more careful and protective of services to our people, in my opinion.
And what we touched upon with the BMA guy was that they've brought down all these waiting lists by bringing that millions of pounds worth, and now they're going to be going upwards because they're putting a sort of hold on some of the procedures. It doesn't sound right to me. I've
done a lot of research into the finances that Manx Care have had, and it's enormous. Synaptic's money sits outside of that, and he stated it was £28 million. We've brought waiting lists down. I happened to actually be in Ramsey Cottage Hospital yesterday,
which is going to be closing their emergency
and that
weekends.
had just been announced yesterday,
Yeah.
and the minor injuries unit, and surely it's more cost effective to make sure that could be kept open, because it's a possibility there's going to be extra clinics put on, and I believe I think it was the CEO that she's hoping to move some of our consultants into these extra clinics. If you put an extra clinics on, that puts more pressure on the services like x-rays, radiology, bloods, everything else, and then they possibly will. And I think it was the other consultant from the BMA, Mr. Querran, he said people's conditions will get worse. If you're seeing more people in more clinics, there's possibly more people going on waiting lists for operations. So I don't think £220,000 was the right fix for this elective surgery, and we're losing so much theatre time.
I've just had a wicked thought that in a normal time, surely the local MHKs for the area would be jumping up and down to hear that they're going to lose their emergency facilities in Ramsey. Hang on. I don't think I've heard anything yet.
Well, what I am interested to hear from the CEO, because she said that some of the areas for contingency and for savings that they tried to achieve, weren't able to. I'd love to know what they are. So that is an area I'm going to be seeking some more answers on, as to where and what that's about.